My name is Leslie Beavers, and I am the Education Coordinator for Peak Vista Women's Health. Today's webinar is planning a healthy pregnancy and what you need to know moving forward. So, before we get started, I wanted to just point out that at the end of the webinar, you will receive a follow-up with a post-survey evaluation. If you don't mind taking that, that always helps us to make sure our presentations are what you guys are looking for. And you'll also be able to submit any questions that you have at the end of that presentation as well. So one more thing before we start, if you've already started your prenatal care at Peak Vista Women's Health Center, you've received this book, Your Guide to a Healthy Pregnancy. You'll notice on some of these slides there will be a page reference number, and this is the book that it's referring to. If you've not already started your prenatal care at Peak Vista Women's Health, that's okay. You'll receive this book whenever you do start, and you'll be able to look through that at that time. So let's get started. So your prenatal visits. A pregnancy lasts 40 weeks. Some people say 9 months. It's actually a little bit longer than a 9-month pregnancy. And there's 3 trimesters. They're roughly about 13 weeks each. So at your new OB appointment, that'll be the longest appointment most likely that you'll have. So you may feel fine and you want to know why you need to see your provider so often. So in the beginning, weeks 0 to 27, you'll come in every 4 weeks. At your 3rd trimester, around 28 weeks, you'll start coming in every 2 weeks to meet with your provider. And those last 5 weeks of pregnancy, you can expect to be seen weekly at that point. If there's any complications with your pregnancy, though, your provider may want to see you more often. So the prenatal care is just simply the medical care that you'll get throughout your pregnancy. It's to make sure that your health and baby's health is going well throughout that time frame. They'll check to make sure that the baby's heartbeat is strong, the baby is growing well. They will do certain testing during that time, and you'll be able to ask your provider any questions also. So what happens at your prenatal checkups? Your very first appointment, that will be your new OB appointment. They will do a medical history, order labs, do a physical exam, and discuss your due date, when that will be, based off of when your last menstrual cycle was. If you don't know, or they want to double check, may order an ultrasound at that time. So at your first visit, the medical history, they're going to want to know about any past pregnancies you've had or any surgeries. They'll ask about any family and genetic history, medications you take, tobacco use, alcohol use, drug use. They'll want to know all of that. Your immunizations, if you're up to date on your immunizations, they'll ask about any allergies that you have, and anything else that may affect your health. So at future appointments following that one, they are going to check your weight and your blood pressure each time. You may also get a urine and or a blood test, check your baby's heartbeat, make sure it's nice and strong, do certain prenatal screening test also. Later in your pregnancy, your provider may also measure your belly to check your baby's growth, feel your belly to check and see what position the baby is in, ask you about baby's movement, and may ask you to do a fetal kick count to track baby's movement. You may receive a flu shot and a Tdap vaccine at one of those later visits, and they're going to continue to make sure your blood pressure and your weight are within healthy ranges. They may possibly do a pelvic exam to check your cervix for any changes too. And pages 6 and 7 of your Guide to a Healthy Pregnancy, that it'll go in a little more detail about what those tests are. So I mentioned getting your flu shot and your Tdap shot. On this chart here, you'll notice we're going to focus on the very first shot listed and the very last one. The flu shot is important for women to get during their pregnancy because it not only helps prevent you from getting the flu, it also gives your baby protection as well. The same for the Tdap vaccine. The CDC says that women that get the Tdap vaccine while pregnant, their babies have a better protection against whooping cough than babies whose mothers did not receive the vaccine during pregnancy. You'll get the Tdap vaccine, or they'll ask if you would like the Tdap vaccine, anywhere from 27 to 36 weeks gestation. And then this provides protection for your baby up to 2 months after birth when you receive that. For the flu shot, we do recommend the actual shot and not the nasal spray for pregnant women. And if you look on page 35 of your Guide to a Healthy Pregnancy, you'll find out more information on vaccinations. This next slide here just kind of gives you a visual about how those vaccinations work. So 2 weeks after getting vaccinated, the mother develops antibodies to influenza, which is the flu, and whooping cough, which is that Tdap vaccine. Antibodies enter the placenta and transfer to the baby. The baby is born with those antibodies that provide protection against influenza and whooping cough for the first few months of their life. So now we're going to switch over and talk about prenatal testing. There's different types of prenatal tests. Some you may have, some are optional, and some your provider may request that you have. So what are prenatal tests and why are they important? As you can see, the image there, that's an ultrasound image. Ultrasound falls into all of those categories that are listed. Prenatal tests are just the medical tests that you're going to get during your pregnancy. They help your healthcare provider find out how you and your baby are doing. Like I said, ultrasound falls into several of those categories. Ultrasound can be useful in many ways. They can determine if there's a problem or monitor the condition of your baby. They can make sure your baby is growing and developing properly. They also use it to calculate your due date and determine if there's more than one baby. And it can also be used to locate the placenta and measure the amount of amniotic fluid. So some of the routine prenatal tests that you can expect during your pregnancy would be your blood pressure being checked. They're wanting to make sure that you don't have preeclampsia. Preeclampsia is when a pregnant woman has high blood pressure and signs that some of her organs, like her kidneys and liver, may not be working properly. They'll also order routine urine testing. They're looking for any infections, like a bladder infection or kidney infection. They're looking for any protein in the urine. Protein in your urine can also indicate preeclampsia. Routine prenatal screen, that will be ordered at your new OB appointment, that intake appointment, and they're testing to see what your blood type is and looking for RH factor. They will check for any STDs or STIs during that time and look for any cystic fibrosis markers. They may even do a pap smear at that time if it's indicated. Another routine test is your glucose tolerance test, or your GTT, or also known as your glucose test. That is done around 24 to 28 weeks of pregnancy. And it could also be ordered during your intake, your new OB appointment as well, if you're at a higher risk. So this test is testing for gestational diabetes. Another routine test that you can expect to get around 36 to 37 weeks gestation is the Group B strep, or the GBS test. It is a vaginal and anal swab that is done later on in your pregnancy, and they're testing for the presence of a bacteria called GBS, or Group Beta strep, in the mother. This bacteria can be harmful to baby, but not to mom. But if you do test positive, they will just treat you in labor to make sure that that doesn't pass on to baby during delivery. So next is monitoring testing. Some of the monitoring tests that are usually done, these are done later in pregnancy and can include that fetal movement test with a kick count to see how much baby is moving during the hour. Non-stress testing. Another monitoring test is the contraction stress test to see how many contractions you're having. And then there's also a biophysical profile. And that's a combination of ultrasounds with the non-stress testing, and it gives the provider a more detailed report. Next is screening test. What screening test can you expect? Screening tests measures baby's risk of developing diseases or medical conditions. And they're usually done in the first 2 trimesters, so before 28 weeks. And they're looking for any chromosomal abnormalities, such as Down syndrome, or carrier disorders, or neural tube defects. Around 18 to 22 weeks gestation, you can expect to have an anatomy ultrasound. That is done to identify any abnormalities with the baby and take measurements to see how well baby is growing during that time. Your ultrasound tech may even be able to tell you if you're having a boy or a girl during this ultrasound time. Diagnostic test. Those determine if the baby actually has the disease or medical condition that were indicated during those screening tests. If a genetic screening test comes back positive or your provider needs more detailed information, you may have a diagnostic test ordered. So this is just breaking it down by trimester. Your first trimester, you may have the early ultrasound or the dating ultrasound ordered to determine when your actual due date is. That is done at maternal fetal medicine, it won't be done at the Women's Health Center. And then you have the option for that first trimester screening. The first trimester screening is also done at maternal fetal medicine, or MFM, and it's done before 14 weeks gestation. They're looking for any risk of trisomy 21, Down syndrome. And then during the second trimester, the tri-quad screen, it is also optional, and it's done before 21 weeks gestation. And they're looking for any neural tube defects, such as anencephaly, spina bifida, or any other genetic defects. This is when, during the second trimester, you'll get that fetal anatomy scan, where you can find out what your baby's gender is and see how he or she is growing. And then you'll get that glucose screening, that glucose tolerance test, around 24 to 28 weeks. Third trimester, around 36 to 37 weeks, is that Group B strep test, or the GBS test that we talked about on that last slide. So some common discomforts of pregnancy. There are quite a few listed there. And if you look at page 17 through 23 of your Guide to a Healthy Pregnancy, it'll go into more detail about each one of these that are listed. I just want to highlight a few of those, though. So breast changes. You are going to notice that your breasts are going to be sore and more full. As pregnancy progresses, your breasts are going to produce the colostrum that your baby needs when he or she is born. Whether you plan to breastfeed or not, your body is naturally going to go ahead and produce that colostrum. So later on during pregnancy, you may notice some leakage. That's perfectly normal. Just wanted to, I know that question comes up a lot, and so I wanted to make sure that the breast milk leaking is okay. Another is teeth and gums. During pregnancy, there's so many hormonal changes that your body is going through. It can cause your gums to swell or bleed. So keeping regular dental care throughout your pregnancy is very important. If you haven't seen a dentist yet, go ahead and schedule that routine cleaning. Let them know that you are pregnant, because they most likely will not do the x-rays unless there is an issue. But making sure you stay and keep your good oral health throughout your pregnancy is very important. Another, you're going to notice that you're going to be going to the bathroom often, urinating often. Your body has a lot more blood in it than it did before pregnancy, and you're producing a lot more fluids. So you're going to need to drink more, which is going to make you go to the bathroom more often as well. Another is your increased heart rate. I mentioned that you have a lot more blood volume in your body. That also is going to raise your heart rate. So that is also normal during pregnancy. And another one that I wanted to point out on this sheet is cravings. Not just random cravings for pickles and ice cream or anything like that. That's okay. But things that are not food So clay or dirt or detergent, anything that's not food related, please let your provider know as soon as possible. That is a condition that can develop during pregnancy. So we want to make sure that you're not experiencing that, or if you are, that we get you the treatment that you need. So did I forget any common pregnancy discomforts? Morning sickness, that was not listed because I have a lot more information to tell you about the morning sickness. You can read more about that on page 21 though in your guide to a healthy pregnancy. So morning sickness, also called nausea and vomiting during pregnancy, or NVP, is just, it develops in those first months of pregnancy. It is the strongest around, or the worst around 9 weeks. Most women, morning sickness tends to go away when they get into that second trimester, around 14 weeks. But though it's called morning sickness, it can happen at any point during the day, and it can last all day long. Mild morning sickness doesn't harm you or your baby. But if nausea or vomiting becomes severe, called hyperemesis gravidarum, it can cause serious problems during pregnancy, and you may need to be hospitalized for that. So some tips for dealing with nausea are listed on page 21. There in that book, but you can try things like keeping crackers beside your bed, having 1 or 2 before you go to bed at night so that you're not going to sleep on an empty stomach, having a cracker or 2 before before getting up out of bed in the morning. Having something on your stomach can also help with that nausea. Ginger, lemonade, mint tea can help with that. Eating small regular meals throughout the day or snacking during the day can help with that morning sickness. And then switching from prenatal vitamins to the gummy prenatal vitamins or the chewable prenatal vitamins can sometimes be easier for the nausea. So foods to avoid or limit. I do want to talk about making sure that you're eating from all of the food groups during your pregnancy. Fruits, vegetables, grains, proteins, and dairy. They're all very important to get a variety of nutrients during your pregnancy. So baby has a variety of nutrients to grow and to thrive. If you go to the myplate.gov website, there is a section there for pregnant or breastfeeding mothers for even more information on eating healthy during your pregnancy. So eating from all the different food groups gives you a variety of nutrients. Having a colorful plate, meaning that your plate doesn't just have one solid color of bland foods. Having colorful foods on your plate ensures that you're getting lots of different nutrients. So some things to avoid during pregnancy. You'll want to avoid consuming any unpasteurized or raw milk or dairy products. Sometimes soft cheeses can be made from unpasteurized milk, so you want to pay attention to that. And some juices are also unpasteurized, so you'll want to avoid that as well. Certain meats and fish you'll want to avoid too. Making sure that your chicken, meat, beef, pork is all cooked completely before consuming it. Washing your fruits and vegetables thoroughly also, because you and your unborn child are more susceptible to foodborne illnesses. So we want to take those extra precautions to make sure that doesn't happen. Avoid any store-made salads like chicken salad, egg salad, tuna salad. You'll want to avoid those. Heating up any luncheon meat or hot dogs until they're steaming hot, or any deli meat, making sure that those are steamed before consuming those. Avoiding alcohol. So no amount of alcohol is safe during pregnancy. That includes beer, wine, liquor, malt drinks, and mixed drinks. So avoiding alcohol altogether because there is no safe amount during pregnancy. And we mentioned the non-food items before. So if you're having any cravings for that, again, please let us know. Certain fish do have a higher count of mercury that you'll want to limit during pregnancy. And then food and drinks that contain caffeine. So coffee, tea, and soda. Caffeine can actually dehydrate you, so making you more thirsty. So you want to limit that caffeine intake during pregnancy also. So food shopping on a budget. Buying healthy foods like fresh meat, fresh fruits and vegetables seems to be much more expensive than buying not so healthy or packaged and pre-prepared foods. So what do? Just some tips here to make that a little bit more budget friendly is to make a budget. Know how much you have to spend before you go to the store. Plan your menu for the week so you're not buying things that you don't need for your meals. Looking for coupons, and then always make sure that you eat before you shop so you don't have any impulse buys there. Peak Vista Women's Health has a list of food banks. If you feel like you don't have enough food in your home, please reach out to us and we can provide that food bank list. You may even qualify for WIC or for SNAP benefits too, and we can help you with that information too. Making sure you buy whole fruits and whole vegetables. It's much cheaper than buying the ones that are already pre-cut and ready to eat. And then keeping staple foods on hand can also be a way to keep your budget low. Example is having beans in your pantry, rice, pasta, frozen vegetables, pasta sauce, and peanut butter. Those are all budget-friendly items. So now we're going to switch over and talk about the do's and don'ts of having a healthy pregnancy. So do increase your water intake during pregnancy. You'll want to also make sure you're drinking plenty of water if you're planning on breastfeeding too. So the general fluid needs increase during pregnancy in order to support fetal circulation. So making sure baby is getting enough oxygen, amniotic fluid, and for that higher blood volume that your body now has. The current recommendation for water during pregnancy is 8 to 10 glasses of water each day, or 80 to 100 glasses of water each day. If you're having difficulty trying to drink that amount, try adding citrus fruit to your water so it's not just plain. Setting goals throughout the day to make sure you're drinking so many glasses at each point throughout the day. And then if you do have caffeine, make sure you're drinking extra water to compensate since caffeine does dehydrate you. So do eat healthy during your pregnancy. We covered some ways to do that. So getting enough nutrients, how do you know if you're getting enough nutrients for you and your baby? Knowing how much to eat, eating foods from all of the different food groups, finding a balance between getting enough nutrients and keeping a healthy pregnancy weight. Those are all the things that we're about to discuss. And you can find more information about those on page 31 and 32 of your Guide to a Healthy Pregnancy. So you may have heard that your eating habits change during pregnancy, and that's okay. What nutrients do you need during pregnancy to keep your baby and you healthy? So during pregnancy, you get a lot of nutrients from different sources of food groups, such as the grains, proteins, fruits, vegetables, and your dairy. Other sources of nutrients are fats and vitamins and minerals. So you're taking your prenatal vitamins daily already, and that's very good. So your protein. Proteins help your body with muscle and tissue growth and also with your baby's growth. Proteins can be found in foods like beef, pork, chicken, eggs, milk, cheese, dairy products, nuts, and seeds. Carbohydrates. Those are going to be found in your grains, and they're your body's fuel to help you with your daily activities. Fiber is also a complex carbohydrate, and it can be found in plant foods, and it helps with digestion. So you can find fiber in vegetables such as cabbage, spinach, kale, fruits like berries, oranges, apples, and peaches with the skin. And then I mentioned about the fats. A certain amount of fats are also important for your body. During pregnancy, the fats you eat are a source of energy and help your baby's organs and the placenta. Just be careful not to have too much saturated fat or trans fat, such as butter, heavy cream, meats with a high fat content. Other nutrients that you need during pregnancy are folate or folic acid. Those help prevent birth defects of the brain and the spine. And you can find those in enriched and fortified products like bread, rice, cereals, leafy green vegetables. You can also have, will also have folic acid, and citrus fruits. Calcium, this strengthens your bones and your teeth. Iron helps your body create more blood to help make sure your baby is getting enough oxygen. Good sources of iron can be found in meat products and in beans. DHA is the kind of fat called omega-3 fatty acid, and this is important for brain and eye development for your baby. So how many servings each day should you have of each of these food groups? And how many calories do you need during pregnancy? How many extra calories do you need during pregnancy for your baby? So most pregnant women need around 300 extra calories per day during pregnancy. And this chart on the side here is from the March of Dimes. So you can go to their website too for more information. So for grains, you're going to want to eat around 6 ounces a day during your first trimester, and then around 7 ounces a day during your second trimester, and 8 ounces a day of grains during your third trimester. Vegetables, you'll want to make sure you're having around 2.5 cups each day of vegetables. So a cup of vegetables is equal to a cup of raw or cooked vegetables, or 1 cup of vegetable juice. For fruits, you'll want 1.5 to 2 cups each day. So that's equal to 1/2 cup of 100% fruit juice, or 1/2 cup of fresh, frozen, or canned fruit equals a serving. Dairy products, you'll want to make sure you're eating 3 cups each day of dairy. So a cup of milk, a cup of yogurt, 2 small slices of cheese equals a cup. Protein, so during that first trimester, around 5 ounces each day, 6 ounces in your second trimester, and 6.5 ounces in your third trimester. So some examples of an extra 300 calorie snack could be an apple and cheese, like hard cheese like cheddar or Swiss. Greek yogurt with berries and granola is another healthy snack option. Vegetables or chips with guacamole. A granola bar, or even fresh fruit and a nut butter can be where you get those extra 300 calories each day. So weight gain during pregnancy. So I mentioned they're going to check your weight at each one of your prenatal visits, and they're wanting to make sure you maintain a healthy weight gain throughout your pregnancy. A healthy weight gain is going to be determined based off of your body mass index, or your BMI. That's going to be your pre-pregnancy weight, how much you weighed before becoming pregnant, calculated with your height. So the chart here will show what your weight gain should be if your BMI was considered underweight, if you were at a healthy weight, if you're considered overweight, or if you're considered obese based off of your BMI. So a healthy BMI is anywhere from 18.5 to 24.9. And then if you're at a healthy weight, you should gain anywhere from 25 to 35 pounds throughout your pregnancy. If you're carrying just one baby, you can see the bottom row there on the chart will show you, if you're carrying twins, what appropriate weight gain would be. So talk with your provider if you have any questions about what your healthy weight should be during your pregnancy. On the back of your healthy pregnancy book, there is a place to record what your weight is at each visit. Also, what your blood pressure was, your baby's heart rate, all of that information you can keep up with here and track what your weight gain is throughout your pregnancy. So gaining weight slowly and steadily is best during pregnancy. So don't worry if you don't gain a lot during that first trimester, or if you gain a little more or less than you think you should in any week. You may have some growth spurts where you put on several pounds in a short period of time and then it tapers off, and that's okay. If you're overweight or obese and are gaining less than the recommended based off of this chart, talk with your provider. If your baby is still growing well, your weight gain may be fine. So how can you track your weight gain during pregnancy? So you can keep a journal, or you can use the back of the book, this healthy pregnancy book that I just mentioned, and then write down every time that after your visit what your weight was, so you can track what your weight gain is. So where do you gain the weight during pregnancy? Where does all of this weight come from? So if you're at a healthy weight before pregnancy and say you gain 30 pounds, which is right in the middle of the recommended amount for a healthy weight, here is where all of that weight would come from. So baby would weigh around 7.5 pounds of that. The amniotic fluid, which is what surrounds the baby in the womb, is another 2 pounds. The blood, the extra blood volume that you have in your body, will account for around 4 of those pounds. Body fluids, another 4 pounds. Your breast would contribute 2 more pounds to that. The fat, protein, and other nutrients, 7 pounds. And then the placenta will weigh around 1.5 pounds, and the placenta grows in your uterus, also called the womb, and supplies the baby with the food and the oxygen that baby needs through the umbilical cord. And then the uterus will weigh around 2 pounds, and that's the place inside you where the baby grows. So being overweight during pregnancy, don't ever try to lose weight during pregnancy. You don't want to diet. Some diets can reduce the nutrients your baby needs to grow and to develop. So don't try to stay at the same weight or lose weight during pregnancy. How do you know if you're overweight or obese? That BMI chart you can refer to see if what category that you fall in based off of your pre-pregnancy weight and your height. Being overweight during pregnancy can cause complications for you and baby, but there are things you can do before and during pregnancy to help you have a healthy baby. 3 in 4 women, about 75% of women in the United States, are considered overweight, and about 4 out of 10 women aged 20 to 39, about 40% in the United States, are considered obese. So what kind of pregnancy complications can being overweight and obese cause during pregnancy? High blood pressure, preeclampsia, and blood clotting problems. And it can also cause you to have a higher chance of gestational diabetes. You're more likely to have complications with the C-section, such as an infection or losing too much blood. And then what problems can baby have that can due to you being overweight during pregnancy or obese? Complications for baby can include premature birth, birth defects, microsomia, also called large for gestational age, or LGA, meaning that your baby weighs more than 8 pounds 13 ounces at birth. And if you have gestational diabetes, your baby may also have problems with breathing, low glucose levels, and or jaundice. So what can you do to improve your chances of having a healthy pregnancy and a healthy baby? Talk with your provider and find out how much weight gain would be healthy for you during your pregnancy. Do get early and regular prenatal care. Make sure you're attending each one of those prenatal appointments, even if you feel fine. Do make sure you're eating healthy foods, eating from all of the different food groups and getting a variety of nutrients. And do something active every day. If you're not already doing something physically active, start slow. Start, walking 15 minutes a day and build up to 30 minutes a day of moderate intensity walking. But don't diet. Moderate intensity exercise means that you're active enough to sweat and increase your heart rate, but you're still able to talk while you're walking. It's recommended for everyone to walk around 30 minutes a day, 5 days a week, about 2.5 hours a week of physical activity. If you're not able to do that now, split that up into 15 minutes here in the morning maybe and 15 minutes in the evening until you can work your way up. And then depending on your weight gain during pregnancy or your BMI before pregnancy, your provider may even want you to do a little bit more exercise than that. Exercising during pregnancy. At your first or your next prenatal care checkup, ask your provider if exercise during pregnancy is safe for you. If you were exercising before pregnancy and your pregnancy is going well, most likely you can continue those exercises you were doing before. So regular physical activities can reduce your risk of pregnancy complications and ease any pregnancy discomforts like back pain. Some activities you'll want to avoid during pregnancy, like any contact sports, skiing, can also not be safe during pregnancy. If you look on page 36 and 37 of your Healthy Pregnancy book, you'll have there's examples of some easy exercises that are safe to do during pregnancy. There is a video here. We will send that out to you in the follow-up to be able to watch if you'd like to. The video is on the March of Dimes website, marchofdimes.org. You can go there and search for exercise during pregnancy and watch that also. So is it safe? The next couple of slides are going to talk about what is safe during pregnancy. So caring for your pets when you're pregnant. So if you have rodents like hamsters, guinea pigs, and mice, they may carry a particular virus that can be harmful to you and your baby. So be very cautious with that. Caring for cats during pregnancy, they may also carry toxoplasmosis. So how does toxoplasmosis spread? You can get toxoplasmosis by cleaning the kitty litter, by touching dirt like garden soil where a cat may have been, because it comes from the feces, or from eating uncooked meat, especially pork, lamb, or deer meat, also called venison. And then if you have a dog, making sure that your pup doesn't jump on your belly while you're pregnant. The next is radiation in pregnancy. You're exposed to or come into contact with radiation, small amounts, nearly every single day. It comes from natural sources like the sun, and man-made sources like microwave ovens and medical x-rays. These kinds of radiation don't cause serious harm. Just make sure you tell your healthcare provider that you see, such as your dentist, that you're pregnant before getting any x-rays or any other tests that may use radiation. Over-the-counter drugs, OTC. On the very back page of your Healthy Pregnancy book, there is a approved list of medications that you can take during pregnancy and during breastfeeding. So please look at that. No need to talk to your provider if it's on that list. So some over-the-counter medication and supplements and herb products aren't safe during pregnancy. If it's on this list, then your provider is okay with those. Anything that's not on there, make sure you talk with your provider before taking it. Prescription medications. So tell your provider about any prescription medications that you take. You may need to stop taking a particular medication or switch to one that is safe to use during pregnancy, but don't stop taking any prescriptions without talking with your provider first. And make sure any provider who treats you with medication knows that you're pregnant. Next is traveling during pregnancy. So being pregnant doesn't mean that you're stuck at home. Just keep in mind, be mindful of any COVID restrictions and the risk of COVID with traveling. If you're having a healthy pregnancy though, it's usually safe to travel. The best time to travel really just depends on how you feel though. Most women feel that the second trimester, they have the most energy and are the most comfortable, and they feel like that's the best time for them to travel. But I will say that taking a cruise is not recommended after 20 weeks of pregnancy. International travel is not recommended after 28 weeks. And then most airlines won't allow you to fly after 36 weeks of pregnancy. Sex during pregnancy. So if you have a healthy pregnancy, then it should be safe for you to have sex. And it doesn't hurt the baby. The amniotic fluid in your uterus helps protect your baby when you're having sex. But if you do notice any heavy bleeding, painful cramping, or leaking amniotic fluid, call your provider or go to the emergency room right away. And if you've had any pregnancy complications now or in the past, you may want to talk to your provider before that. And some more. Is it safe? Drinking alcohol. We discussed a little bit about that earlier when we discussed what to avoid or limit during pregnancy. So alcohol can cause problems for your baby at any point during pregnancy, even before you know you're pregnant. So drinking alcohol during pregnancy makes your baby more likely to have premature birth, birth defects, and fetal alcohol spectrum disorders. Smoking, so tobacco use during pregnancy. Smoking during pregnancy can cause problems to your baby as well, such as premature birth, low birth weight, birth defects. It also increases your baby's risk of SIDS, which is sudden infant death syndrome. If you're pregnant, you shouldn't smoke, or you should stay away from secondhand and third-hand smoke. I know most people know secondhand smoke, but third-hand smoke is those chemicals that attach to whatever is in the home or in the vehicle where you smoke. So it attaches to the walls, to the carpet, to the floor, to the furniture, to any items in the room. And what makes that even more unsafe for babies, they crawl around on those floors. They put everything in their mouth, so they're ingesting those harmful chemicals. So you'll want to avoid that. At Peak Vista Women's Health, we have a program called Baby and Me Tobacco Free for any pregnant woman that recently quit when they found out they were pregnant or is still currently smoking. The program is designed to help you to quit before baby is born and to stay quit after baby is born. So at your next appointment, if that's something you're interested in, just let your provider know, and they will get you in touch with one of us to get you started in that program. So next is marijuana. No amount of marijuana has been proven safe to use during pregnancy. And if you are breastfeeding, you should not be using marijuana at all. The rule is if you're going to use marijuana, then do not breastfeed, because those chemicals are passed on to baby through the breast milk. It should not be used to treat morning sickness. If you're having problems with morning sickness, let your provider know and they can prescribe something that's more safe for you to use during pregnancy. And then other drugs. No matter how the drugs are used, it's dangerous. Neonatal abstinence syndrome is a group of conditions a newborn can have if their mother was addicted to drugs during pregnancy. This happens when a baby gets addicted to a drug before birth and then goes through drug withdrawal after birth. And then the last thing is abuse during pregnancy. So whether it's emotional, physical, it is never okay. Unfortunately, some women experience abuse from their partner, and 1 in 6 abused women is first abused during their pregnancy. More than 300,000 women are abused by their partners during pregnancy each year. So if this is you, if you feel threatened or you're abused, tell someone right away that can help. Ask your healthcare provider for help or any local agency that deals with domestic violence. Call or visit the National Domestic Violence Hotline. The number is right here on the screen, so please reach out and get help. All right, and that concludes our webinar today on how to have a healthy pregnancy. So if you have any questions, you'll receive a follow-up email to this webinar to submit any questions directly to us, and we will get those answered to you as soon as possible. Here is our address and our phone number if you need to make an appointment, and here is my contact number here if you'd like to reach out to me. We look forward to seeing you soon at Peak Vista Women's Health. Hopefully you found this webinar helpful and you will attend our future webinars as well. Thank you.